Hi, this is Dr. Fruth, family physician, and this is today's consultation. We are in the middle of an epidemic of deaths related to opioid overdose in the United States. 1 in 7 Americans are touched by addiction one way or the other. And in 2015, 35,000 people died of opioid overdose. 2/3 of those were related to prescription drug use. Well, today I'd like to talk about office-based opioid treatment using buprenorphine as a medication-assisted treatment program for individuals with opioid addiction. First, though, I'd like to talk about what is an opioid. Opioid is a class of drug which includes the illicit drug heroin and prescription pain relievers, which include drugs like hydrocodone, oxycodone, morphine, fentanyl, and Dilaudid. So what does an opioid do? An opioid interacts with mu receptors in the brain that produce pain relief, but also pleasurable effect. Well, what is an opioid addiction? Think of it as a chronic condition of the brain where the individual pathologically pursues the relief or the pleasure from the use of the substance, and it disrupts normal functioning of the brain. Addiction is present in individuals from all walks of life. And if left untreated, addiction can lead to serious health problems, including death. So what are the signs of addiction? Having blackouts or withdrawals, being unable to stop the substance, neglecting family, engaging in illegal activities in pursuit of the drug. But before I talk about office-based treatment programs, I'd like to ask, how do opioids kill someone? Well, the opioid interacts with receptors in the brain that eventually lead to depression or slowing down respiration. This leads to confusion and a decrease in the oxygen that's delivered to the brain. This can result in brain damage and eventually death. There is a medication called naloxone or Narcan that can reverse an opioid overdose, and it's available without a prescription in most states. It can be delivered by injection, nasal spray, or there's also an auto-injector. There are several types of treatment programs for people with opioid addiction. There's inpatient and outpatient rehab, there's self-help groups, and medication assistant with medications like buprenorphine or methadone. Medication-assisted treatment programs, which are office-based, use the drug called buprenorphine. Buprenorphine has very high affinity to those mu receptors that the opioids like to attach to, but don't have the euphoric effect and work to reduce or eliminate cravings. This then leads to normal brain functioning, normal body functioning, and eventually a self-directed life. The office-based program considers the whole person and includes substance abuse counseling and attention to other psychosocial needs. In office-based treatment programs, we considered opioid addiction a chronic medical problem, like that of diabetes or hypertension. So who is a good candidate for this? Well, it would be one who has a diagnosis of opioid use disorder and someone who's ready for change. Most insurances do pay for this type of program, which is found to be effective and safe. The individual cannot have dependence, though, on alcohol or benzodiazepines. In our program, if it is suspected that someone does have alcohol dependence or benzodiazepine dependence, we do refer to a higher level of treatment. The individual can have addiction to heroin or to opioid pain relievers, but should not have any other unstable psychiatric disorder. Well, how do outpatient opioid treatment programs work? It's used by prescribing buprenorphine in brand names like Suboxone, Zubsolv, Bunavail. And these are structured programs that involve a contract and regular use of Breathalyzer, urine drug screen, accessing databases for prescriptions of narcotics and opioids and controlled substances, substance abuse counseling, assurance of use of storage of the medication, and knowledge about Narcan. The first day of an office-based treatment program is called the induction phase. The individual needs to come to that appointment in withdrawal. And this means that if the individual uses a short-acting narcotic or opioid, then at least 12 hours needs to be since the last use. And if a long-acting narcotic is used like Oxycontin or MS-Contin, at least 24 hours since last use. The individual is going to be given a self-assessment for how much withdrawal they feel they are in, but your physician is also going to do an objective analysis using heart rate, how much yawning there is, how much runny nose, sweating, restlessness, aching joints, etc. Most of the time, the person is also going to have a breathalyzer done and a urine drug screen done, and any use of benzodiazepine is going to be addressed to determine that there's not dependence. Benzodiazepine can have serious interaction with buprenorphine. Sometimes that induction is done in office, but often it's done at home. So the individual is going to be given a very strict schedule for how to take that medication, and the goal is to use the dose that gives the least amount of cravings and withdrawal symptoms. Well, after the induction phase, you'll be asked to come back within 1 week for a follow-up appointment. Now this enters the stabilization phase, which lasts for about 1 to 3 months. This phase, the dose of buprenorphine will be determined that was the effective dose to relieve cravings and to relieve withdrawal symptoms. Attention is going to be given to substance abuse counseling and any other psychosocial needs that the individual has. You'll be seeing the physician about every 2 to 4 weeks during this period. Well, following stabilization is the maintenance period, and this lasts for about 3 to 12 months. However, it's very individualized. During this period, dose reduction or tapering of that buprenorphine can be considered, but nothing is set in stone. And we do expect relapses, and those can be addressed again on an individual basis. So in conclusion, there's strong evidence that office-based opioid treatment is safe and effective. They should consider the whole person using medication-assisted therapy as well as substance abuse counseling and attention to your psychosocial needs. You might find that your own family physician is trained to offer this service. Insurance companies can be good resources for providers in your area that can offer this treatment, and this also can be Googled and can be Googled through the official Suboxone website. Remember, addiction is everywhere around you. An office-based opioid treatment program is there to help that individual lead a self-directed life. This is Dr. Fruth, family physician, and this is today's consultation. These videos are meant for educational purposes, so please contact your personal healthcare professional for your healthcare needs. But do please share, subscribe, and follow.